Myself, Shirish Pavra, second year MBBS student from DUPMC, Jalgaon. My today's topic is rational pharmacotherapy. Rational use of medicine. Rational use of medicine require that the patient receive medication appropriate to their clinical needs in doses that meet their own individual requirement for an adequate period of time at, at the lowest cost to them and their community. Rational prescribing. The criteria to evaluate rational prescribing. 1. Appropriate indication. The reason to prescribe the medicine is based on sound medical consideration. 2. Appropriate drug is efficacy, tolerability, safety, and suitability for the patient. 3rd. Appropriate dose, route, duration according to specific feature of the patient. 4th. Appropriate patient. No contraindication exists and the drug is acceptable to the patient. Likelihood of adverse effect is minimal and less than the expected benefit. 5th. Correct dispensing with the appropriate information, instruction to the patient. 6th. Adequate monitoring of patient adherent to the medication as well as the anticipated beneficial and untoward effect of the medication. Factor influencing prescribing. First is knowledge of the prescriber. Second, role models. One tends to follow prescribing practices of one teachers or senior or also popular physicians. Third, patient load. Heavy load tends to foster routinized symptoms based prescribing. Fourth, attitude to afford prompt symptomatic relief at all cost. Fifth, imprecise diagnosis. Medication is given to cover all possible causes of the illness. Sixth, drugs promotion and unrealistic claims by manufacturers, unethical inducements such as gifts, dinner parties, conference, delegation, etc. Patient demands. Many patients are not satisfied unless medication is prescribed. Misconception, unrealistic expectations, pills for every ill belief. Impact of the irrational prescribing. Delay, inability in affording relief, cure of disease. More adverse drug effect. Prolongation of hospitalization, loss of man days. Increased morbidity and mortality. Emergence of microbial resistance. Process of rational prescribing. First, establish a diagnosis, at least provisional. Second, define therapeutic problems, example pain, infection, etc. Define therapeutic goal to be achieved, example symptom relief, cure, prevention of complication, etc. Fourth, select the class of drug capable for achieving each goals. P-drug concept criteria. P-drug are the drug you have chosen to prescribe regularly and with which you step become familiar. They are your priority choice for given indication. Step criteria. S for safety, T for tolerability, E for efficacy, P for price. P-drug list selection follow above criteria. First, decide the route, dose, duration of treatment, consideration patient condition. Second, provide proper information and instruction about the medication. Monitor adherence to the medication, compliances. Fourth one, monitor the extent to which therapeutic goal is achieved, example BP lowering, peptic ulcer healing, etc. Fifth one, modify therapy is needed. Last, monitor any adverse drug event that occur and modify therapy is needed. MCQ first. Which of the following best defines rational pharmacotherapy? Option A, using the most expensive medication available. Option B, prescribing medication based on patient symptom alone. Option C, select the medication based on scientific evidence and patient specific factor. Option D, using the same medication for all patients regardless of their condition. Option C is the correct answer. Selecting medication based on scientific evidence and patient specific factor. Second MCQ. In rational pharmacotherapy, what does the term off-label use refer to? Option A, using medication is higher doses than recommended. Using medication for purpose not approved by regulatory agencies. Option C. Selecting medication based on personal preferences. Option D. Using generic medication instead of brand name drugs. Option B is the correct answer. Using medication for purpose not approved by regulatory agencies. MCQ third. When prescribing medication, which of the following is not a crucial consideration for rational pharmacotherapy? Option A. Patient age and gender. Option B. Known allergies or adverse reaction. Option C. Efficacy of medication for the patient condition. And option D. Cost of the medication. Option D is the correct answer. Cost of medication. Fourth MCQ. What does the term P-drug commonly refer to the concept of pharmacology? A pretend drug with high prices. Option B. A placebo drug with no active ingredients. Option C. A personalized drug with tailored to an individual generic profile. Option D. A prescription drugs with high potential for abuse. Option C is the correct answer. A personalized drug tailored to an individual specific generation. Last MCQ. Why is the concept of P-drug important in modern medicine? Option A. To identify counterfeit drugs, to ensure drug affordability for all patients. Option C. To promote personalized and effective drug treatment. And option D. To regulate over-the-counter drug sales. Option C is the correct answer. To promote personalized and effective drug treatment. Thank you, guys.